Hi, this is Amanda Oldervik, and today I'll be talking about Chagas disease. This is for Bio 204C0A. To begin, I'm going to be talking about the background information and about who discovered it and what really causes this disease. So to start, it was originally found by Carlos Chagas in 1909 and it is mainly in the Americas. It is referred to as the American trypanosomiasis. According to the CDC, it is most common in Latin America where poverty is super high just because they do not have things that help with their hygiene and cleanliness. It is from a parasite called Trypanosoma cruzi, or more commonly known as T. cruzi. It is transmitted to animals and people by insect vectors, and it infects vertebrate and invertebrate hosts and attacks the digestive system. So some animals I'm going to list off are from the western United States, which are rodents, wood rats, and skunks that are the most commonly infected by T. cruzi. And in the eastern United States, possums, armadillos, and skunks are also the most infected on the east side. Some signs and symptoms I'm going to talk about are based on if you've been bit and what to look for. So according to Cedars-Sinai in Los Angeles, the main symptoms that they talked about were things from the flu, so like fever, fatigue, body aches, and headaches, which really can be caused by any bacterial, viral, or fungal infection, so they don't want to break it down just to that. Some more symptoms include diarrhea, vomiting, and loss of appetite. Some signs of having the disease would include having a rash, swelling near the eyes, and enlarged glands. And this usually happens when being bit by the kissing bug, and it's usually almost immediate swelling of the eye or redness, and the rash may be apparent 1 to 2 days later. Some more chronic symptoms that may appear if you do have the disease for a longer period of time and you just don't know about it would be things like heart failure, abnormal heart rhythm, trouble eating, and constipation. The picture on the right shows you what the swelling of the eye may look like. So next I'll be talking about the pathogen and virulence factors. So the bug that I am talking about is a triatamine bug and is known as the kissing bug, and it transmits the parasite to humans, according to the Johns Hopkins Medicine website. So I'm going to explain it to you. So during the night, these kissing bugs feed on the blood of humans and animals, then defecate all over the body and in the places that they bit. So the feces are going into those little punctures in the skin. If somebody does not know that they were in contact with a kissing bug and the bug is crawling all over your body, there may be feces laying on the body. And if you wipe your hands on your arms where the kissing bug was at and you were not immediately bit there, and then you move the feces on your hands and then wipe your eyes, mouth, or nose with the feces, it may lead to the infection just because you're spreading that infectious parasite all over your face. Some more things that may cause Chagas disease are things like blood transfusions, organ transplants, birth from mother to baby, exposure in a lab, and eating uncooked foods with the feces from the infected bug on it. Blood and organ transplants are big just because if you are infected and you do put your blood into somebody else that you're donating it to, it may cause problems, and I will explain that in just a second. And to this picture to the right is the bug that is infected, and this is the rash from the bites that may appear. Next, I will be talking about the pathogenesis. This is a diagram to the right, but I will be breaking it down for you. So the epimastigote has a flagellum that helps it swim around inside of the infected bug. Then it multiplies through binary fission, and both of those still have flagellums. The trypomastigote can then invade the human cells, but this is still sitting in the bug. And then when it is injected into a human through a bite. The mastigote then multiplies in the cell when it enters the human body. Once it is divided in the body, blood trypomastigote moves through the blood and lymph nodes, and this leads back to, again, organ and blood donations, because you do end up having the parasite within your blood. So this could be a problem when making donations of your blood or being an organ donor. Also, if you are infected with the disease, it may, or with the parasite, and a non-infected kissing bug lands on you and bites you and sucks your blood, which it does, and that bug is not infected, it will now be infected if you do have that parasite. Next, I'll be talking about the epidemiology. There is no transmission through the disease of coughing, sneezing, or respiratory transmission. It spreads like any other insect-borne disease, so like malaria and the West Nile virus. Since it is mainly found in Latin America, there have been over 5 million Chagas diseases worldwide, so not just in Latin America. So it is everywhere, but mostly there. Next, I will be talking about the diagnosis, treatment, and prevention. So to diagnose it, you take a sample of blood from an individual who is suspected with the Chagas disease. You make a blood smear on a slide, stain it, and investigate under a microscope and look for signs of parasites. The picture on the right shows you what a parasite may look like under a microscope with the red blood cells. Two treatments that are given to kill the parasite is the benznidazole and the nifuramox. Both are almost 100% effective in killing the parasite during the beginning phase of the infection, but if you do have that infection for a longer period of time, then it may not work. So that's why it is not 100%. Next is the prevention, and currently there are no vaccines for T. cruzi, so the main way to protect yourself from kissing bugs are things like spraying insecticides in and around your house, making sure your house is clean to prevent infestation, and good bodily hygiene, and this leads back to places in Latin America that are more poor because they do not have resources to make those things happen. And lastly, to prevent is testing the blood of testing blood, organ, tissues, and cells of people who do donate and receive those things. And that will overall prevent the spread of T. cruzi from donors. And next is my works cited, and then works cited for my pictures. Thank you.